So there are risks for doing the opioid treatment. Some of them are kind of medical side effects that could happen, such as just feeling the withdrawal system still while you're going and taking the medicine to help you get off of it. Another thing that can happen is the receptors don't necessarily, or they work, but sometimes they work too well where you just don't feel euphoric at all and don't really derive pleasure from anything. And even going just kind of off of that, sometimes a risk is the medicine, buprenorphine might not work right, in which you go and it doesn't correctly stick to the receptors, and it basically doesn't really work. But then there's also a chance or a risk of being addicted to the drug that you take to help you get off of the opioids. But then going kind of along the lines of you don't feel euphoric at all, and because of that pleasure that you do not get anymore, it sometimes just makes people not want to take the medicine because they want to feel the pleasure of just everything that's going on, what the drug would do to them. But then it also doesn't necessarily curb the cravings that you can get for the drug. So you could still be taking the medicine to help you get off of it, but you could still be wanting to take the opioid, even though you're on the medicine. But on the other side is, if you don't try the treatment at all, people will just keep getting addicted to it, and it'll just kind of start tumbling down and getting out of hand, with people just doing whatever they can to get the drug to feel euphoric, and just not having that. So they're just not having the pleasure and wanting it so bad that they'll do whatever they can to get it, which isn't good because it can lead to a lot of troubles, riots, and other stuff that can happen.
It is important to consider the social and economical aspects of this issue. In the United States, Suboxone and Suboxone are approved by the FDA for federal treatment. These drugs allow the user to experience no withdrawals from their addictive drugs. Methadone is also federally regulated, but in clinics only. From 1999 to 2017, more than 700,000 deaths have occurred in the United States due to opioid overdoses. In 2017 alone, more than 70,000, that's 10% of the 20-year total, have died in just that year. 68% of those users has prescriptions to opioid drugs. Methadone, a drug commonly used to treat opioid addiction in the United States, costs on average $6,500 a year to treat. That's more than 2 times the average amount that a consumer pays for healthcare in the United States. Haltrazone is also another drug used to treat opioid addiction in the United States, and that costs on average $14,000 a year, which is almost 5 times the amount that the average user pays for healthcare in the United States of America. Additionally, it's almost 3 times the amount that someone who has diabetes or liver disease would pay for healthcare in the United States. Other economic aspects that need to be considered when talking about opioids and opioid treatments in America are the criminal justice aspects for people being locked up for these things, for overdosing, etc. Babies also being born with opioid dependencies because of parents that had that in their household or in the system at the time of birth. Also, transmission of diseases through needles and through the bloodline. Overdoses occur, and injuries while under the influence, as well as a loss of productivity.
Opioid treatment and ethics. Is it moral and ethical? Yes. The main goal for opioid treatment is to get people off a drug that is controlling their lives and making people a slave to it. Opioids, like heroin, cover the pleasure receptors in our brain to make us want it more and more until we are fully addicted. Medications like Suboxone and Subutex contain buprenorphine, which fakes the brain into thinking it is consuming opioids but is slowly weaning the brain off of the addiction. I believe that these medications are moral and ethical because medications like Suboxone specifically contain naloxone, which prohibits the drug to be overdosed by sending the brain into withdrawal symptoms when directly entered into the bloodstream instead of dissolved under the tongue. This means that there is a safeguard built into the medication that prevents it from being just another drug that is easy to get addicted to. What does the Bible say about opioid treatment? The Bible doesn't specifically talk about drug addiction at all, but does mention quite a few times about getting drunk on alcohol. The Bible also talks about how our body is a temple and that we should treat it as such. By overdosing on drugs, we are abusing our bodies that were given to us by trying to only find fake pleasure. The Bible talks about how the Lord will never tempt us more than we can handle in 1 Corinthians. Does opioid treatment align with Cornerstone University's beliefs? In the Cornerstone University Handbook, it explicitly states that illegal drug use is not permitted and that the university provides many ways of help with addiction. In the handbook, it did not say anything about the drug Suboxone, which I would assume if a medical professional recommended it to a heroin addict, Cornerstone would stand behind it because it is all in the intent of recovery and a relief of addiction for the student.
Advantages and disadvantages of medication-assisted treatment. Using the assistance of medication has been proven to help addicted patients find a way to stop their abuse of opioids while reducing some of the effects of quitting the drug cold turkey. There are a few different medication options available to opioid users, but each is different and comes with their own sets of advantages and disadvantages. The first treatment option I will be evaluating is methadone. Users who take this drug to combat their opioid addictions have been known to develop improved physical and mental health. Taking this medication suppresses the effects of opioid withdrawal and other side effects that go along with it, as well as blocking out the effects of other problem opioids if they happen to be taken alongside of methadone. The disadvantages of methadone treatment are that the use of the drug requires the user to go to a federally regulated clinic, which is typically undesirable for users, and that there's a potential to abuse the drug, given that it provides a similar experience to other opioids. The next option is taking naltrexone. Unlike methadone, naltrexone doesn't have any addictive properties, which means that there is less of a risk of abusing the drug. This medication also helps by blocking the euphoric and pain-relieving effects of opioids. This drug does come with a fair amount of drawbacks, the biggest one being that it doesn't actually suppress the effects of opioid withdrawal in users, nor does it stop opioid cravings. This in turn makes it hard for users to stay on the drug and not relapse back into opioid abuse. The last option I'll be evaluating is Suboxone. This medication is a popular choice for getting users off of problem opioids. Suboxone suppresses the effects of opioid withdrawal and other side effects that accompany it. Like naltrexone, it doesn't cause euphoria that problem drugs provide, and at the same time it blocks out the effects of other opioids if they are used at the same time. As another plus, unlike the use of methadone, the user isn't required to go to any federally regulated clinics to take the drug. If taking Suboxone as directed, few risks are present. However, due to an ingredient in the drug, if the user tries to inject Suboxone, they will immediately cause painful symptoms of withdrawal.
In summary, we believe that using Suboxone and other mediums as assistance in the opioid addiction recovery process is an ethical solution. As Andrew mentioned in the ethics slide, there were 3 Bible verses that stuck out to us about opioid addiction and substance abuse in general. These 3 verses were Proverbs 21, Romans 13:13, and 1 Corinthians 10:13, all of which deal with alcoholism and not being tempted beyond what we can bear. Though these verses represent the Christian view towards substance as well, perhaps the next 2 verses we should look at are 1 Thessalonians 5:11, therefore encourage one another and build one another up, just as you are doing, and Luke 6:31, which is do unto others as you would have them do unto you. If someone has a struggle with opioid addiction, it is clear that they do not need to be beaten with rules of how they should not have fallen into the trap, as many addicts understand that what they're doing is wrong, but rather they need to be uplifted by those who love them and recognize the potential of what they can be. As Christians, we are called to identify sins, but we are first called to love our neighbors as ourselves. Simply telling the addict that what he or she is doing is wrong will not make them change, and giving them Suboxone won't fill the void that they're hurting with. Therefore, as we go forward, we think that using Suboxone as a medium for opioid addiction relief is a step in the right direction and can be considered ethical, but replacing the void left from opioids with the Suboxone is not the way to create long-term success for the individual. We feel that success for the individual will be found in love, community, personal growth, individual purpose, and ultimately Christ. So let's look at others for who they can be and not who they currently are. Therefore, we must remind ourselves that anyone can become successful and find the redemption they are looking for no matter the difficult things they have dealt with in their past. So let's not view them as addicts, but as struggling brothers and sisters who desire to improve themselves. Thank you all for your time and have a great upcoming semester.